Hi, good morning. Happy Friday. TGIF. I don't know about you guys, but I'm super glad it's Friday. I want to show you guys a little bit about what we're going to talk about in our class on Saturday, tomorrow, the Dealing with Diastasis workshop. We're going to talk about a lot of core activation, safe core activation, what the core actually is, how to know what you shouldn't be doing, how to know if exercises are okay for you to be doing. But right now, let's talk about the deepest muscle of the abdomen, which is your transversus abdominis. We're going to call it TA. And that is the muscle that I tend to focus on a lot here because it works directly with the pelvic floor. So those two muscle groups are called synergistic muscles, so they work together. So I spend a lot of time talking about TA with my clients, and I'm going to show you how to find it, okay? So on your back, ideally with your knees bent, you want to find your neutral pelvis. So I'm kind of rocking back and forth, and here my back is pretty smushed against the mat. Here my back is arched. I could kind of get a Matchbox car under there if I wanted to. And somewhere in between is my neutral spine. Okay, so I found my happy place. Now, you're going to find your hip bones, okay? And you're going to walk your fingers about an inch in and down, okay? So I'm finding my soft valley. Right, it's supposed to be kind of soft, and it's a little bit of a dip, okay? So while I'm here, I'm going to take a breath in. And did you see my belly rise there? See, I'm not ashamed. I'm letting my belly go. As I breathe out, I am gently drawing my lower belly towards my spine, and I can feel my TA muscle kicking in under my fingertips. So it's almost like a firmness. You'll almost feel that muscle pop up into your fingers and it'll get firm, okay? And notice the rest of my body is not doing a whole lot. So I'm not doing this. I'm not tipping my hips back. I'm not lifting anything. I can activate this muscle by exhaling and drawing the lower belly in. So think about it like if you're wearing maybe your skinny jeans and you need to pull your lower belly in away from the button. That's a good way to think about it. My favorite cue for myself is I want to imagine that I can bring my hip bones closer towards the middle. And so I use that muscle to, that's kind of my thought process. That makes sense to my body. This can be tricky if it hasn't been working well for you in a while. Physical therapists are trained to identify this and to help you with this. So by all means, if you are confused, if you don't feel it working, find a PT to help you. Doesn't have to be a pelvic health PT, but certainly we spend a lot of time talking about the relationship between pelvic floor and transversus. But that's the muscle that should be kicking in, especially if you have a diastasis. So again, that's what we're going to talk about on Saturday, tomorrow. How to find that muscle, how to avoid compensating with the other muscles that can sometimes put a little more pull on that tissue at the midline. But this is a nice exercise just to start with on your back, just getting those muscles kicking in, and you can do it in sitting as well. And again, this is really the only thing that should be happening. Okay, I can isolate it, and nothing funky's going on up here. I'm not doing this. I'm not doing butt squeezes. I can really isolate this guy. And exhaling can be very helpful in helping you find that muscle. So I hope you guys have a great Friday. I hope you stay cool. And if you are still interested in coming tomorrow, it's at 1 o'clock. We still have some spaces. Going to be a breathing space, and it's going to be a really good workshop. You're going to get a lot of exercises to work on at home, okay? So, y'all message me if you have any questions, and I hope you have a great day. Thanks.